I'm Dr. Gregory Kelly, and I practice family medicine with Palmetto Primary Care. I started about a year ago with the company in Mount Pleasant. Cervical cancer is cancer of an organ called the cervix, which is right between the vagina and the uterus in females. We now know that cervical cancer is most often caused by a virus called HPV, or human papillomavirus. Any female with a cervix can be affected by cervical cancer. Oftentimes, cervical cancer is completely asymptomatic unless it's very late in the course. You may have bleeding, weight loss, or swollen lymph nodes. Lowering your risk for cervical cancer can be done by routine screenings with pap smear and HPV testing. And this can catch cells early before they're cancerous when they're starting to change. And the other most important way to prevent against cervical cancer is getting your HPV vaccine if you're eligible. A pap smear is a test that's done in the physician's office. Your physician will examine the vagina and cervix and take a collection of cells, and then that will be sent to the lab and looked under a microscope, and then the testing will also be done for HPV. Age 21 is when we recommend pap smears start being performed. Depending on your age, every 3 to 5 years if the results are completely normal. For women aged 21 to 30, we recommend every 3 years if the results are all completely normal. And ages 30 to 65, it's actually every 5 years if the results are normal and if it's done with the HPV testing. It's important to get pap smears all the way up until age 65. The HPV vaccine is a vaccination that's given to protect against different strains of HPV, or human papillomavirus. So it protects against multiple different strains of HPV, including the ones that cause cancer and also ones that cause warts. And this can also protect in men against oral cancer or anal cancers. The HPV vaccine is typically started around age 11 or 12, and if you're eligible, you may benefit from the HPV vaccine up until age 45, depending on what your physician says. If you think you may be due for cervical cancer screening, give our office a call.